surgical site infection. Most of these infections are already been covered in skin and soft tissue infections. Now, when we say surgical site infection, as the name suggests, that means a patient after having undergone any kind of operative maneuver ended up having an infection which was not previously present is surgical site infection. In simple terms, that means had the patient not undergone that operative procedure in that particular healthcare system, he or she would not have the infection. By definition, SSI is defined as infections which is seen to develop at the surgical site within 30 days of the operative procedure. This is the broad definition. However, please remember for some operative maneuvers, like especially orthopedic surgeries or surgeries where an implant, that is a foreign body, is placed within the body, that time period may increase up to 90 days. Now, like all other previous infections, SSIs also have an endogenous or an exogenous source. Obviously, the endogenous source could be depend upon the kind of procedure that is done. For example, in any case of abdominal surgery, the surgery may or may not enter into the intestinal wall. Obviously, if the intestine is exposed, that means the chances of getting infected is high. And if it is not coming in contact with the intestinal wall, that means the chances are low. So, in these deep seated surgeries, the infection may be either from the patient's own body, either from the skin or internal organs, or the organism could be directly placed because of a procedural fault, that is deviation from the asepsis. Those will be considered to be as exogenous. Now take a look over here. What are the patient related risk factors? The first one is age. Why age is important? Because with age, the ability to defend against any sort of infection or inflammation due to procedure is reduced. Secondly, malnutrition, diabetes, immune suppression, or a very important finding is also called as skin colonization with MRSA. Especially in hospitals which have many incidences of MRSA infections, most of these infections are caused by patients' own endogenous flora. This staphylococcus is generally colonized all over the body, but particular sites are more predisposed, like anterior nares, armpits, that is axilla, the groin. These are the common areas. Now, if the patient already has MRSA colonization, the probability of getting the infection is even higher. Next, duration of the hospital stay. Obviously, this is pretty eminent. The further the patient stays in the hospital, the probability of getting infected with the hospital uh, organisms present in the hospital settings is even higher. Then, some of the individual risk factors like smoking, obesity also predispose, because smoking directly causes reduced ability of fighting against inflammation. So does obesity. And perhaps the most important patient related risk factor is the type of the wound on which the procedure is performed. I'll come to it later. Other related factors would include the procedure related. Now, if we look at the procedure related, what are the important part is, first is improper surgical scrub. That means the aseptic precaution taken by the surgeon and his team is improper, or any kind of break in the asepsis procedure, or especially this is very important, prolonged operative surgery time. Some of the surgeries take prolonged period of time. As the time gets prolonged, the probability of getting infected is even higher. In your surgery, you will learn about many processes which take a lot of time during surgery. So those surgeries would be very important. Next is inadequate or inappropriate antimicrobial prophylaxis. I think you must be aware any patient who is undergoing surgery is given antibiotics prior to surgery. Now it is very important to choose the right antibiotic for prophylaxis, and even more important is timing of the antibiotic that is given. In pharmacology, we have already learned about the half-life. So if we are giving the prophylactic antibiotic much ahead of the scheduled time, what will happen? The half-life will cross before the surgery takes place. Ideally, the antibiotic prophylaxis should be properly timed so that the highest concentration of antibiotic should be during the time of the surgery. Okay. So if I am giving the antibiotics a lot earlier, then also it will be inadequate. A lot later, then also it will be inadequate. Then the choice of the antibiotics, you may end up choosing a wrong antibiotic. Next, very important part is poor perioperative glycemic control. Now, diabetes is a risk factor, that is certain, but even people who are non-diabetic, during the surgery, it is seen that if the glycemic index remains higher, the probability of infection spreading becomes even higher. Again, as previously stated, any kind of emergency surgery, obviously there will be a lack in asepsis, hence causing more infections. And another very important part is operative shaving. Obviously, human beings will have hairs on the body, and these hairs will ultimately complicate and cause wound infections. So previously, it was suggested that the hairs on the body, whether it's on the limb in case of orthopedic surgery or in the abdomen or chest in case of abdominal or thoracic surgery, the hair should be shaved. But nowadays it is recommended rather than shaving, the hair should be either epilated, that means plucked out, or removed with hair removing creams, because shaving can cause microtrauma in the skin, thus enabling the commensal bacteria on the skin to enter into the subcutaneous tissue. Next, obviously, like any other infections, the inoculum size, the virulence of the organism that is entering, they will also depend. That will also depend, and as I have already stated, as far as the environmental concern, any implant will interfere in the normal healing process. That will further enable the chances of infections. Furthermore, during any kind of operative procedure, we are giving a lot of uh, substances to the patient, be in the form of IV fluid or antibiotics, etc. So all these can also get contaminated and cause infections. Now, depending on the wound type, I have already said we have four classes of wound. The first class of wound is called as a clean wound. So what is a clean wound? It is uninfected with no inflammation and no hollow viscous which is entered. No, even in an abdominal surgery, suppose we are doing a intestinal resection, there will be incision. Suppose a patient falls from height and breaks both the forearm, bones in the forearm, but there is no external wound, only internal fracture. The orthopedic surgeon then recommends open reduction and internal fixation and performs a surgery. Now, this wound is a clean wound. That means there is no inflammation, it is not infected, and obviously no viscous is entered. So, this type of wound has the least chance of getting infected. Why? Because if no viscous is entered upon, then no endogenous organism from viscous can contaminate. The only chances of contamination of wound will come from the skin of the wound and from the procedural factors. Next comes is the clean contaminated wound. What is a clean contaminated wound? It's a hollow viscous entered under controlled conditions without unusual contamination. A simple abdominal surgery, for example, appendicectomy. When we are removing the appendix, what we are doing? We are entering into the abdominal cavity, entering the viscous, and where the viscous is entered, but in a controlled environment. That means there is no spillage, no perforation. It's a clean surgery. Then we will classify it as clean contaminated wound. Now suppose if the same surgery is performed on a patient where there is appendicular perforation. No, that means inflamed tissue pus will come out in the peritoneum. Now this will become contaminated wound. Or a road traffic accident where there is open injury, that will be a contaminated wound. So contaminated wound are open fresh accidental wounds, or a major break in the sterile technique during surgery, or surgeries which involve entering into the colon, obviously because colon has huge number of bacteria. Those will be classified as contaminated wound. And finally is a dirty or infected wound. That means a surgical procedure done when an active infection is already present. That means an appendicular abscess with perforation. When I say abscess, that means the infection is already there. And then when we enter for revision surgery, that will be considered as a dirty wound. That this type of wound has a highest rate of infections. This is the categorization of the wound. But surgical site infections can be classified depending on the depth of the wound, either superficial, deep, or organ space. What is superficial infection? Superficial infections means superficial, that is skin and subcutaneous tissue on the incision site. That is called as superficial incision. Now, if this infection invades into deep incisional site, that is the muscle or the fascial level, then we call it as deep wound infections, commonly seen with. Now there is some exceptions. If you can remember, then fine. If you cannot, that is also fine. Some surgeries like breast, cardiac, or implant surgeries, the time period is 90 days. For all of the surgery, it is 30 days. Last is organ space infections. As the name suggests, that is, the infection develops at the level of the organ space, intraperitoneal, intrathoracic infections. If these kind of infections occur, we call it as organ space infections. Okay, so this is a classification depending on the depth. So superficial, deep, and organ space infections. Something can be done for prevention. These preventive steps we can classify into three parts. First is before, what are the steps we can take before performing the procedure, some steps during performing the procedure, and some steps after performing the procedure. So before performing the procedure, what we can do is preoperative bathing with a normal soap or an antimicrobial soap. What it does is that you cannot remove the organisms on the skin which are living on the skin, but some can be removed simple by bathing. It is the same principle for which a surgeon does hand surgical scrubbing. Next would be to look for MRSA carriers. I have already told you, some people will have, everybody has Staphylococcus aureus on their body, but some may have the resistant variants. If we do find somebody with resistant variant, we must be very careful, because the patient may be infected by his own organism, and this would be very difficult to treat. So what we can do is we can screen those patients, and if we do find they are having MRSA, we can decolonize them with mupirocin ointment. That is to remove the MRSA prior to the surgery. Next, I have already told you hair removal. Earlier, shaving of the hair was done. Now, it is recommended either to go for epilation or using hair removal cream. Intraoperative procedures. Now, antimicrobial prophylaxis, surgical antimicrobial prophylaxis must be provided in all cases except in clean surgery. Clean means the clean wounds, and ideally it should be given about 60 to 120 minutes before the incision is made. However, it will vary on the type of the surgery, the duration of the surgery. All these factors will have to be accounted for. Next important is surgical hand disinfection of all the healthcare workers involved in the surgical process. Surgical site preparation, that means site means incision site. That incision site should be prepared with the use of chlorhexidine. Various other factors I have already told you regarding the patient related factors, that is the level of oxygenation, temperature regulation of the patient, glucose regulation, and hydration level. These should be maintained throughout the surgery. Finally, post-operative measures would be wound dressing. That means post-operative the wound should be taken care of. If any kind of fluid that is oozing out, it should be checked properly whether there is erythema. Initially, all wounds will have erythema, but what we need to look for is whether this erythema is increasing or not, whether the discharge is increasing or not, or whether the discharge is become purulent or not. And if we do find these things are coming up, that means we need to take proper step, which may include reopening the surgical site and do a revision surgery. So till now we have covered about the four main types of healthcare associated infections: catheter related bloodstream infections, ventilator associated events, and surgical site infections. Now grossly, all infections can be ideally prevented by using preventive measures. How? To use some processes. These processes are called as care bundle approach. That means any device which is present or any procedure which is done will lead to increase of infections. Now, based on what is a bundle, what do you mean by bundle? A bunch of things. So when we pick up a bundle, what do you do? Do you pick up each and every individually? No. You pick up the bundle in itself. That means whenever we are trying to go for prevention, we have to perform all the steps. We cannot just follow one or two, we have to perform all this. Hence, it is called as bundle approach. Now, let us look at the bundle approach for each and every infection. First is catheter associated urinary tract infections. We have two bundles. One is called as insertion bundle and other is the maintenance bundle. If you recall, the infection can occur from endogenous or exogenous, and the most common route is during insertion and during maintenance. So let us look at the insertion bundle. First is the catheter should be inserted only when appropriate indication is present. That means for all patients catheterization cannot be done. You should have a definite indication for urinary tract catheterization. Remember, every time you put a catheter in any patient, you are predisposing him or her for infection. So you should have a definite indication. That means the benefit should outweigh the risk. Then only you can put the catheter. Now next option is during insertion, your process should be aseptic process. That means the catheter itself comes in a pre-sterilized covering. So if it is pre-sterilized, you cannot open the catheter before putting the catheter and keep it in the open. It will contaminate. Similarly, your hand should be clean during insertion of the catheter, and the catheter should be inserted by a no-touch technique. What is a no-touch technique? Suppose this is the catheter and suppose this is the outer covering. So after performing hand hygiene, I put up on a sterile gloves. Then my assistant would remove the top covering and it will show the catheter. But the bottom covering is still in my hands. I am not going to touch the catheter itself, especially the top part. Then I will insert the catheter to the urethra of the patient and slowly push by pushing the covering, not the catheter. That means in any stage the catheter should not be touched by the gloved hand. Then the closed drainage system that I had already told you, that must not be disturbed at any point of time. Or the bag and the catheter should be placed appropriately depending on how the patient is lying down. That means it should always be below the level of the patient. Next, the catheter must be secured properly. If we don't do that, what will happen? Every time the patient moves, the catheter will move and there might be repeatedly microtrauma in the periurethral region and higher chance of infection. So the catheter must be fixed. This is all about insertion. Next comes as the maintenance. As long as the catheter is placed in situ, you have to take the maintenance bundle. That is, first is daily catheter care. And in daily catheter care, what you need to do is that clean the urethral meatus every day, because colonization start at the point of the entry of the catheter, that is the urethra. Every day you must check for the security of securing the catheter and the drainage bag and the closed system. Whenever you are handling the catheter or the drainage system, you must perform hand hygiene. So this is about the maintenance bundle. Now for the central line, similarly we have an insertion bundle and a maintenance bundle. The insertion bundle, again, obviously hand hygiene must be present along with personal protective. Please remember, when we are entering any kind of catheter into the central veins, the cardiovascular system is sterile. That means you are entering into a completely sterile system. So your method should be totally aseptic. That means like in an operation theater, we are performing everything in a almost sterile environment. That should be done including hand hygiene, personal protective equipment. The site of the insertion should be prepared like that in surgery, that is with the skin preparation before surgery. Then we have to use what is called as semi-permeable dressing to put up on the site of the insertion. Now what is this semi-permeable dressing? If you don't put a dressing, what will happen? The catheter will move around. It will cause further trauma and injury and cause infection. So we need to fix it. After fixing, what will happen? There will be inflammation, oozing of fluid, because it's a wound. Even though it's a clean wound, but it's still a wound. And this fluid will be contaminated by organisms. So if we use a semi-permeable wound dressing, the fluid will be evaporated and the chances of wetting the wound will be reduced. Thereafter, we have to maintain the catheter. Among the maintenance bundle, we have daily aseptic central line handling, which would include hand hygiene and hub cleaning. What is hub? If you remember, the central line has got at least 3 ports. In all the ports, we are either putting some medicines or we are taking the blood sample. Now this is the hub. Now we need to clean this hub with alcohol. Every day, at least 3 to 4 times daily with alcohol. Then we have to look for signs of local infection, that is the entry site. We have to check daily for signs of infection, and we have to change the local dressing on the site every day with 2% chlorhexidine. And please remember, all these bundles you have to perform and you have to document. As the dictum says, work not documented is work not done. Next is for patients on ventilator. Many a times you will end up intubating a patient in emergent conditions with no proper uh, precautionary measures, but we should always try to anticipate the need of intubation in patients who are critically ill so that the intubation can be done with proper precautionary methods. Among the other things, what we need to do is after the patient is put on ventilator, we need to maintain the endotracheal tube. Among the maintenance, we need to have hand hygiene. Next, we need to put the patient at a position so that the upper part of the body is about 45-degree angle from the bed. Why? Exactly. If you put the patient in supine position, there will be higher chance of the fluids regurgitating from glottis into the subglottic area. Next is daily oral care with chlorhexidine solution. I have already told you the endogenous flora comes from predominantly the oral cavity and the gut. So for the oral cavity, oral hygiene is very important. It should be done daily in these patients. The patient may be comatose, the patient may be delirious, but still we have to perform the oral hygiene. Then I think I already told you the patients are given proton pump inhibitors, which reduces the gastric acidity. So the need for the proton pump inhibitor should be evaluated daily so that it could be stopped as early as possible. It is not always possible, but it should be looked upon. Next is the patients on ventilator are obviously very sick patients and they do not move around, obviously. And when the patients are lying down in the same position, there is a chances of a phenomenon that happens. It is called as the deep vein thrombosis. What is deep vein thrombosis? Any idea? Which veins? There are two types of veins. One is the superficial veins and the deep veins. The deep veins, what it does is it takes the venous blood from the lower limb into the inferior vena cava, especially with the muscles of the lower limb, like the gastrocnemius muscle, the calf muscles. Now, when the patient is lying on the bed for a prolonged period of time, he or she is not actually moving the limbs. Hence, those venous returns are not efficient, and the venous blood will ultimately coagulate within those deep veins. And sometimes the coagulated blood, that is the thrombus, may dislodge from this deep vein into the pulmonary circulation, causing pulmonary thromboembolism. And if it does goes into the systemic circulation, it may cause severe or even myocardial infarctions or thrombotic disease. So DVT prophylaxis is very important. And finally, the moment or the day after putting the patient on ventilator, next day onwards, we must assess whether the patient still needs the ventilator support or not, so that we can extubate or de-escalate the ventilatory need as early as possible. Why? Obviously, foreign body, the earlier you remove from the body, the chances of infection will be less. Now, having till now we have learned about the HIs, how to put them, how the infections occur, and a very important part of HI is to ascertain what are the common HIs at our hospital, what are the common infections occurring. How can we find out? We can find out only by doing what is called as surveillance. So this is called as HI surveillance. Now HI surveillance provides the rate, the type of the infections that happen, and how we can address the faults. Obviously, the full surveillance cannot be done at the hospital in toto. Hence, targeted surveillance or targeted areas are done. This is called as targeted surveillance. Now, the surveillance occurs in this way. First, the data is collected, then the data analyzed, and then the data interpretation. Finally, the data is disseminated to all parts of the hospital system so that these infections can be controlled. So this was all about HAIs over here. Okay. Now regarding the infection control part, first what you need to know is what are standard precautions. These things can be asked in both in theory exam and in practical. So these all are, I think, taught in your lecture classes. So I'll be going slightly rapidly so that a revision occurs. Now, please tell me what is the standard precaution? Now, what do you mean by standard precaution? কি বোঝো স্ট্যান্ডার্ড প্রিকশন বলতে কি বোঝো? না, হসপিটাল অ্যাকোয়ার্ড ইনফেকশনের সঙ্গে কি হয়? Guidelines. It was earlier called as universal precaution, but now it is called as standard precaution. What do you mean by standard? Exactly. So standard precautions are the set of precautions that you should take being a healthcare worker irrespective of the patient. পেশেন্টের যাই থাকুক সেটা আমাকে করতেই হবে। দ্যাট ইজ দ্য মিনিমাম। দ্যাট ইজ কল্ড অ্যাজ স্ট্যান্ডার্ড প্রিকশন। বোঝা গেছে? ডিপেন্ডিং অন ইনফেকশন উই মে নিড টু টেক ফার্দার প্রিকশন। Those are called as transmission based precautions. If we don't know or if the patient is not at all infective, still what we need to take precaution is called as standard precaution. So these precautions will entail all individuals, all specimen and all nutrition source. And this has to be performed at every part and region of your healthcare system, be it a laboratory, be it the outpatient department, inpatient department, ICU, OT, etc., whatever. Now, what are the standard precautions? These are the standard precautions. First is hand hygiene. The second will be personal protective equipment. Third is biomedical waste management, spillage cleaning, disinfection of the patient care items, environmental cleaning, respiratory hygiene and cough etiquette, and safe use and disposal of showers. So these are the part and parcel of the standard precaution. এগুলো এই জন্যই রিভিশন করা হচ্ছে, ভাইভাতেও জিজ্ঞেস করা হতে পারে, থিওরিতেও জিজ্ঞেস করা হতে পারে, তখন এই পয়েন্টগুলোকে স্টেট করতে হবে। নাও রিগার্ডিং হ্যান্ড হাইজিন, এটা তোমরা বলবে হোয়াট ইজ হ্যান্ড হাইজিন, বলো। এই অনেক জ্ঞান দিচ্ছ তো পাশে বসে, বলো। তোমাকেই বলছি, ওরকম ভাব করার কিছু নেই। তোমাকে উঠে দাঁড়াও, বুঝতে পারছো? তোমাকেই বলছি, হ্যাঁ তোমাকেই বলছি, উঠে দাঁড়াও, বলো হোয়াট ইজ হ্যান্ড হাইজিন। ডিফারেন্স বিটুইন হ্যান্ড রাব অ্যান্ড হ্যান্ড ওয়াশ কি? ওয়াশ মানে ইউজিং সোপ অর ডিটারজেন্ট, ঠিক আছে? আর কি ডিফারেন্স হচ্ছে? টাইম, ঠিক আছে? হ্যাঁ, ওয়াশ মানে সোপ অ্যান্ড ওয়াটার, আর রাব মানে হচ্ছে উইদাউট ইউজিং ওয়াটার, দ্যাট ইজ দ্য অ্যালকোহল বেসড। নাও কোন কোন সিচুয়েশনে হ্যান্ড ওয়াশ ম্যান্ডেটরি? আমি জিজ্ঞেস করছি হ্যান্ড রাব কখন করবে আর হ্যান্ড ওয়াশ কখন করবে? দ্যাট ইজ ভিজিবলি ডার্টি হ্যান্ডস, বিকজ অ্যালকোহল ক্যানট অ্যাক্ট অন অর্গ্যানিক ম্যাটার. So if your hands are visibly dirty, maybe dirty with say dust, dirt or blood or body fluid, you have to perform hand wash. Hand rub can be performed on clean hands. ঠিক আছে? Fine. Another part of hand hygiene is called as surgical hand scrub. Surgical hand scrub, how it is different? First difference is in hand wash or hand rub, we are cleaning till our wrists. But in case of hand scrubbing, surgical scrubbing, we are cleaning till the elbows. Next difference would be there is vigorous rubbing, first with soap and then using chlorhexidine based liquids so as to decolonize the commensal organism on the hands of the arms. That is very important. Where we need to perform surgical scrubbing? before any operative maneuver. Okay, এটা কি অসুবিধা এগুলোই জিজ্ঞেস করা হয়। তো what are the 5 moments of hand hygiene? এক মিনিট this is WHO moments of hand hygiene, ঠিক আছে? You have to say it out in this order, that is 1 2 3 4. মনে রাখার খুব সহজ উপায়, বিফোর অ্যান্ড আফটার টাচিং দ্য পেশেন্ট, বিফোর অ্যান্ড আফটার ডুইং এনি প্রসিডিওর, and before coming after coming in contact with the patient surrounding. So these are the 5 moments of hand hygiene. That means when you will perform hand hygiene. Correct? Okay. These are the steps of hand hygiene. That is hand rub or hand washing. Only difference would be time and the material that is used between hand rub and hand washing. Steps are all same. পড়ানো হয়েছে, পড়বে? Okay. চলো। Next comes after hand hygiene is personal protective equipment. Now hand hygiene becomes a barrier in transmission. It protects both the healthcare worker and the patients. However, personal protective equipment protect the healthcare worker. So what are the personal protective equipment that we must know how it protects? By getting exposed to patients' body fluid or blood, especially during invasive processes. So these are the personal protective equipments. What are the components of personal protective equipment? That would include first, gloves. Please remember, gloves is not part of hand hygiene. Gloves is part of personal protective equipment. Gloves, depending on surgical gloves or say nitrile gloves used in the laboratory, or even the heavy duty gloves used by the worker who is transporting the biomedical waste. Then mask. The mask could be a surgical mask or an N95 mask. Do you know the difference between surgical mask and N95 mask? Okay. Then we may have a gown. The gown could be a sterile cotton gown or a plastic gown, depending on whether it is used in the laboratories or various processes. Other personal protective equipment would include overalls. Overalls means the overall body cover, and goggles or face shield. Goggles is for protection of the eyes, and face shield so as to prevent direct exposure of the body fluids, and shoes, shoe cover, etc. So these are the part of the personal protective equipment. This is the picture. I think you can get a very good idea. Hospital জিজ্ঞেস করা হতে পারে, what are PPE? Name the PPEs or list down the PPEs. Now these PPE will depend on the type of the infection. How many of you have seen the PPE people were wearing during the COVID pandemic? You have seen. So during those times, the people we used to wear the PPE with gloves, the face shield, the mask, covered the whole body. Why? Because the coronavirus is an airborne disease. Airborne disease. So it may enter through any part. Hence, we need to cover thoroughly. But in other cases, only gloves, mask, or a gown will be sufficient. So depending on the type of the organism we are dealing with, the PPEs may change. The more infectious it is, the more stringent the PPE covering will be there. Acha. Gloves, regarding gloves, what you need to know is you have to perform the hand hygiene before the glove use and after the glove use. Don't let this idea get into your head that I have performed hand hygiene, then I have worn the gloves, I have done the procedure. Now because I have removed the gloves, my hands are clean. So you have to perform hand hygiene before putting on the gloves and after removing the gloves. Now how to put on a glove? এগুলো জানো তো? স্টেরাইল গ্লাভস কিভাবে পুট করতে হয়? বাইরের দিকটা যেন হাতে টাচ না হয়, অ্যান্ড রিমুভ করাটাও ঠিক সেরকম ব্যাপার, ভিতরে টাচ করে এইখান থেকে টেনে বার করতে হয়, তবে এটা so that the outside part does not comes in contact either with the skin of elbows or the fingers. That is called donning and doffing of gloves. Okay, next comes surgical mask or respirators. This is a type of surgical mask. It is made of 3 layered of cotton cloth. See, the purpose of this surgical mask is to prevent any kind of droplet material coming out from the mouth of the people into the surrounding on the patient. That is the purpose of a surgical mask. It does not prevent you from getting infection. If you are having an infection, respiratory infection, it will prevent the transmission from you, but it will not prevent you getting infected from somebody else. For that, what we need is called as N95 mask. Now, coming to donning of mask দেখেছো, টপ পার্টে এখানে একটা তোমার মেটাল ওয়্যারের মতো থাকবে, তাহলে মাস্কটা প্রথমে বাঁধতে হয় এইভাবে, one strap will go above here, one below here. If it goes over there, after a prolonged period of time, you will feel pain in your ears. So one strap above here, one strap below here, and after tying the knot, you must press the metal wire on the nose tip so that the mask fits perfectly in your mouth, and the other end of the mask should be below your chin. So when you are talking, the mask should still cover. Many a times you will find people wearing the mask, either the top part is below the nose or the lower part is above the mouth. So these are many malpractices you will observe, but at least try to learn. Next is, after having used the mask, how to remove them. Please remember, this part of the mask is coming in contact with various things. So you should not touch the outside or the inside part with your hands. So how to remove? Untie the lower knot first, then untie the upper knot, and by holding the ties, you discard the mask. Do not touch the inside or outside part of the mask itself. Now this is a type what is called as the N95 mask. Now what does N95 means? The 95 means it will prevent entry up to 95% of the particulate matter. Now this is the mask which will prevent you from getting infected, especially airborne infections. For example, tuberculosis, measles, or commonly coronaviruses. Now, like a surgical mask, this mask also you need to wear. There are 2 straps, and most of them will come with a elastic strapping, so you don't need to tie it. What you need to do is you need to take the mask, put the upper strap outside, put the mask on your mouth, upper strap above here and the lower strap below here. Then you need to press the nasal seal thoroughly to ensure there is complete air seal. If the air seal is not complete, it will offer no protection. Many a times you will find people wearing an N95 mask over a surgical mask. আগে একটা সার্জিক্যাল মাস্ক পরে তারপর একটা N95 ভাবে বোধহয় it will give you more protection. Absolutely wrong. The protection comes from the air seal. ঠিক আছে? Second part is, after wearing the N95 mask, never touch the outside part. ঠিক আছে? তাহলে রিমুভ করার সময় কি করতে হবে? লোয়ার স্ট্র্যাপটাকে মাথার উপর দিয়ে বার করো, তারপর আপার স্ট্র্যাপটা বার করো, স্ট্র্যাপটা দিয়ে ফেলে দাও। ডু নট টাচ দ্য ইনসাইড অর আউটসাইড পার্ট। ঠিক আছে? সিমিলারলি পিপিইতে আরেকটা হচ্ছে, দিস ইজ কল্ড অ্যাজ দ্য ওভারঅল. Most of the time you will encounter all the overalls in the form of this, like a pajama and a jacket. The wearing is very simple. ভিতর থেকে বাইরে পড়তে হবে, ইনসাইড পার্টটা টাচ করা চলবে না, অ্যান্ড ইউ নিড আ সেকেন্ড পার্সন হু উইল টাই দ্য নটস বিহাইন্ড। এবার এটা খোলার সময়ও তখন নিয়ম হচ্ছে এরকম, when you are doffing off the PPE, there will be no one to help you. So what you need to do, untie the knot and then take it off from outside like this, মানে এইভাবে খুলতে হবে, ভিতরটা টাচ করে যে ভিতরে জামা কাপড় সেটা টাচ করলে হবে না, বাইরে থেকে এইভাবে টাচ করতে হবে। তাহলে হাতটাকে এইভাবে তুলে ভিতরে ঢোকালে, এটা তুলে এইভাবে বার করলে, তারপরে এইখান থেকে টেনে একবারে বার করতে হবে। বার করার সময় এমনভাবে খেয়াল রাখতে হবে, look at this picture, the yellow color is the outside part, when he is taking it off, the gray color is the inside part. The outside part should be folded inside, so that আমি যখন ওটাকে fold up করছি, I am touching only the inside part of the PPE. We should not touch the outside part of the PPE. Okay. Obviously, you need a protective eye equipment. Many people think that spectacles are enough. No, they are not. Normal spectacles are not eye protective material, not even from blood or body fluid splashes. So you need this kind of protection. Depending on the type of the situation where you will encounter, you may have to put on these safety boots or rubber boots or shoe covers. Now a common consensus about how we should don these various PPEs. While donning the first, we need to wear the gown or the overall. Next, we have to wear the mask, that is N95 mask or respirator, then goggles, face shield, and finally gloves. Okay. Now while removing, first we need to get rid of the gloves first. Why? The most contaminated would be the gloves. Next, the face shield. Face shield and gloves will come in contact mostly. Next, the gown, the mask should be removed at the last. মনে থাকবো, এই অর্ডারটা অনেক সময় পরীক্ষার সময় জিজ্ঞেস করতে পারি যে পিপি পড়লে কোনটা প্রথমে পড়বে আর কোনটা লাস্টে পড়বে। তাহলে পড়ার সময় দেখো সবার ফার্স্টে কি হচ্ছে, গাউন পরছি, তারপর মাস্ক, তারপরে হচ্ছে গগলস অ্যান্ড ফেস প্রোটেকশন, লাস্টে হচ্ছে গ্লাভস। দিস আর দ্য ওয়ার্কিং গ্লাভস। খোলার সময় সবার ফার্স্টে কি গ্লাভস, ফেস শিল্ড, মাস্ক, তারপরে গাউন, মাস্ক সবার লাস্ট। এর সঙ্গেই পুরো বায়োমেডিক্যাল ওয়েস্টের রিলেটেড, আমি ওটা আজকে ঢোকাইনি। অবভিয়াসলি বায়োমেডিক্যাল ওয়েস্ট আই থিঙ্ক তোমাদের লেকচার ক্লাসও পড়ানো হয়েছে। There should be specific spillage management. Spillage management, please remember, we should use freshly prepared hypochlorite solution containing about 0.5% hypochlorite. So this was all about standard precaution. তাহলে স্ট্যান্ডার্ড প্রিকশনে কি কি পার্ট, let us recall. What are the parts of standard precaution? Hand hygiene, washing hand hygiene. Next, biomedical waste management. Next, spillage management. Next, PPE. Fine. এই চারটে বলতে বললেই না। Transmission based precautions based on transmission. What are the methods of transmission? First is contact transmission, airborne and droplet transmission. So contact precaution, how to do it? Obviously prevent contact, direct or indirect. Direct means when a person directly touches the patient with the hand and then touches another patient. Indirect will be through fomites or intermediate objects. The common organisms which are spreading through contact transmission would include multi-drug resistant organisms like MRSA, that is methicillin resistant Staph aureus, vancomycin resistant enterococci, or carbapenem resistant enterobacteriaceae. Other would include hepatitis A, E, and please remember this is very important, clostriditis difficile, it causes C. diff associated diarrhea. So how to prevent? First is we have to maintain the standard precautions plus contact precaution. What is contact precautions? We must ensure use of gloves every time any person comes in contact with that patient or the surroundings. Even room যে পর্দা টেবিল চেয়ার যদি থাকে, still should be contacted only with a gloved hand. Then we can cohort the patients. Cohort মানে, what is cohort? Same type of patients with the same infection put in a single room, so that when you enter in that room, you are totally prepared about contact precautions. Secondly, we can transfer the patient to infective wards, or we can disinfect the rooms every day. Next comes is the droplet precaution. Droplet precaution is, I have already told you, perhaps the best method of droplet precaution is put a surgical mask on the patient, so that if he or she coughs or talks, it will not spread in the air. The common agents which are transmitted by droplet precaution would include diphtheria, Neisseria meningitidis, Haemophilus influenzae, etc. These are transmitted by droplet infection. এটাও জিজ্ঞেস করা হতে পারে. Infection control measures would include standard precaution and what is called as respiratory hygiene or cough hygiene. Now, respiratory hygiene and cough hygiene should be taught not only to the healthcare workers but also to the patients and the patient's visitor. So, if you visit the outpatient department of a good hospital, you will find leaflets and pamphlets regarding respiratory hygiene and etiquettes placed over there. That is for the education of the patient and the patient party. For example, most of things you will already know, like while sneezing, do not use your hands, rather use a handkerchief or use the elbows, so that your hands don't get contaminated. Then again the patient can be cohorted or transferred out and disinfected. Finally, coming to airborne transmission, these are very important. Most common airborne transmitted disease, obviously tuberculosis, measles, varicella, that is chickenpox, etc. And there are some processes which may generate aerosol, like what we have learned recently during intubation of a patient. That is an aerosol generating process. So if you are suspecting the patient may be infected, you have to prepare for that. তাহলে aerosol generated যদি airborne infection হয়, what kind of mask that you should wear? You should wear an N95 mask. So how to prevent? To prevent yourself, you must wear an N95 respirator or mask, or you can put the patient in airborne isolation room. What is that airborne isolation room is? Suppose this is a room in which I have admitted patients with, say, tuberculosis. What we need to do is we need to create a slight negative pressure in this room. If we do create a negative pressure in the room, what will happen? Every time the door is open, the air will come in from outside, but inside air will not go out, because in this room all the pathogens are suspended in the air. This is called as airborne isolation. In your outpatient, you can try to prevent getting infected by air. Obviously, if you are in outpatient department, you will encounter patient with respiratory pulmonary tuberculosis. You actually don't know. After performing the test, then you will come to know that patient was indeed infected with pulmonary tuberculosis. Now, from these patients, you might get infected. So, how to prevent your own self? Look at this picture. This is an outpatient room. This is the door. This is the window. Now, if the doctor is sitting over here and the patient is sitting over here, what will happen? The doctor will be totally exposed to the air particles. However, in this scenario, the patient is over here, the doctor is over here, the airflow is over the desk, not directly into the face. That means it also involves architectural part. And in hospital settings, you can find the patients are placed in the beds in series pattern and the windows are on the other side, so that the air can flow over there, but the air will not flow from this patient into the. We can also, nowadays most of the patients will be admitted in hospitals with air control air conditioners. Most of these air conditioners will have a filter which is also called as the HEPA filter. So a HEPA filter will filter out most of the pathogens. Okay. So this is the summarization of the standard and transmission based precautions. All what has been said, this is the summarized part. এটা নোট করে নিতে পারো. And finally, very briefly about a part of the system in the hospital that is called as the hospital infection control. So it should have a committee which will look after it, and this committee is a multidisciplinary committee headed by the medical superintendent, all the heads of the various departments, including heads of sections like CSSD, where all the cleaning and disinfection is done, the kitchen, etc. All should be part of that, including kitchen, linen, laundry, pharmacy, OT supervisor, all will be part of this committee. Now, what is this role of Hospital Infection Control Committee? The first role is to do HAI surveillance, to find out what are the infections that are happening and why they are happening. Then the next role is antimicrobial stewardship program that has to be implemented. I will teach you in a lecture class next week, so I am not discussing AMSP today. Next part would be to educate. You are being taught here today by us, but after passing out you will be the educators, so you have to educate. So that education is to be done by the HICC committee. Staff health, all the healthcare workers should be monitored every 6 months so that they are not infected or affected. That has to be taken care of. If there is an outbreak of any infection or a disease, that has to be managed by this HICC. So that is all about HAIs. জানি একটু বেশি হয়ে গেল, সব কিছু অল্প অল্প করে বলেছি। সো যদি রাউন্ড আপ করতে হয়, I think you have understood about what is HAI, what are the types of HAI, how they occur, how to prevent them with the use of insertion and maintenance bundles, how infections occur and how we can take precaution. That would include standard precautions, transmission based precautions, and we have what is called as HICC or Hospital Infection Control Committee, which will look after both the surveillance to estimate what are the HIs occurring in our hospital, what are the causes, why it is leading to it, then educate all the staff, then if there is an outbreak, to manage the outbreak. These are the important parts of the HICC. And who are involved? The main important people involved in HICC would include the medical superintendent of the hospital, the microbiologists, the infection control officers, head of the department of all medical department, and also other associated hospital areas like kitchen, laundry, CSSD, and pharmacy.